Hi, Cross. Good afternoon. I am Mihiraa. Let's begin the warm-up session. What inspired you to become a nurse?
As a child, I always had a strong desire to help others and make a positive impact in their lives. Growing up in a family where healthcare was valued, I witnessed firsthand the compassion and dedication of nurses in caring for patients. Their ability to provide comfort, support, and holistic care deeply inspired me. I knew that becoming a nurse would allow me to fulfill my passion for serving others while making a difference in their health and well-being.
Describe your experience with electronic health record systems.
Throughout my nursing career, I've gained extensive experience working with electronic health records (EHR) systems in various healthcare settings. I am proficient in navigating and utilizing EHR platforms to document patient information accurately and efficiently. I've used EHR systems to access patient records, input vital signs, document assessments, and track medication administration. Additionally, I have participated in training sessions and workshops to stay updated on the latest features and advancements in EHR technology.
Can you discuss your experience with patient assessments and creating care plans?
Patient assessments and care planning are fundamental aspects of nursing practice, and I have a comprehensive background in both areas. I have conducted thorough patient assessments to gather vital information about their health status, including physical, emotional, and social aspects. Based on these assessments, I have collaborated with interdisciplinary teams to develop individualized care plans tailored to meet each patient's unique needs and goals. I prioritize patient-centered care, ensuring that care plans are holistic, evidence-based, and responsive to changes in the patient's condition.
Describe your experience administering medications and monitoring for side effects.
As a registered nurse, I have administered medications to patients across diverse healthcare settings, including hospitals, clinics, and long-term care facilities. I adhere strictly to medication administration protocols and safety standards to prevent errors and ensure patient safety. I am proficient in various routes of medication administration, including oral, intravenous, and intramuscular. Moreover, I am vigilant in monitoring patients for potential side effects or adverse reactions to medications, promptly addressing any concerns, and collaborating with healthcare providers as needed to adjust treatment plans.
What steps do you take to ensure proper infection control practices are followed?
Infection control is paramount in maintaining a safe and healthy environment for patients, staff, and visitors. To ensure proper infection control practices are followed, I adhere rigorously to established protocols and guidelines, including hand hygiene, personal protective equipment, PPE use, and environmental cleaning. I actively participate in infection control training and education sessions to stay updated on best practices and emerging trends in infection prevention. Furthermore, I promote a culture of safety within the healthcare team, encouraging open communication and collaboration to identify and address potential infection risks effectively.
You can now start the role play.
Good morning, I am Cross Wood, one of the nurses here in the Community Health Center. How can I assist you today?
Hi, I'm here because my son Ted has a splinter in his nail. It's been bothering him a lot, and I'm worried it might get infected.
I can hear the concern in your voice, and I want you to know that you've come to the right place. It's natural to worry about our little ones when they're in discomfort. Well, before we move further, how may I address you?
You can call me Mihiraa.
Mihiraa, let's get a bit more information. Could you please explain in detail about what has happened?
Sure, it happened yesterday while he was playing in the backyard. He accidentally stepped on a wooden board, and I noticed the splinter in his nail shortly after. Well, it wasn't too severe, thankfully. Ted cried a bit, but we managed to calm him down. I tried to pull out the splinter with tweezers, but he was in too much pain, so I stopped.
Thank you for the detailed explanation, Mihiraa. You did the right thing by not forcing it out. Splinters can be tricky, especially in sensitive areas like nails. Mihiraa, I understand how distressing it can be when your child is in pain. I want to reassure you that what Ted is experiencing is not uncommon among children. These sorts of accidents happen more often than you might think, and they're usually easily manageable. Now, let me explain about his treatment stages. First, we'll carefully examine Ted's nails to assess the situation. Then, our doctor will safely extract the splinter, taking every measure to minimize any discomfort for Ted. After the splinter is removed, we'll provide thorough wound care instructions to ensure proper healing. Mihiraa, do you have any questions or concerns about the procedure or Ted's recovery process?
That's reassuring to know, and it sounds like a good plan. By the way, will it hurt Ted when you remove the splinter?
It's completely understandable to be concerned about Ted's comfort during the splinter removal. While there might be a slight discomfort during the procedure, we'll do everything we can to minimize any pain. We'll apply a numbing agent to the area before removing the splinter, which should help Ted feel more comfortable throughout the process. Once the splinter is safely removed, we'll carefully clean the area with an antiseptic solution to prevent any potential infection. Then, we'll apply a sterile bandage or dressing to keep the wound clean and protected as it heals. Rest assured, Ted's well-being is our top priority, and we'll take every precaution to ensure his comfort and safety throughout the treatment.
That's a relief. What should I do at home to take care of his wound?
That's a good question, Mihiraa. At home, it's important to be gentle with Ted's wound to promote proper healing. Avoid picking or scratching at the area, as this could cause further irritation or infection. Encourage Ted to refrain from strenuous activities that might put pressure on the wound and slow down the healing process. Additionally, please keep a close eye on the wound for any signs of increased pain, redness, swelling, or discharge. These could be indicators of infection, and it's crucial to seek medical attention if you notice any concerning changes. By being cautious and attentive to Ted's wound care at home, we can ensure he has the best possible chance for a speedy recovery.
I'll make sure to be extra careful with Ted's wound and keep an eye out for any changes.
Mihiraa, let me summarize the key points we've discussed today. Ted's situation, although worrying, is common among children and easily manageable. We'll begin by carefully examining Ted's nail to assess the situation. Our doctor will then safely extract the splinter, using a numbing agent to minimize any discomfort. Following the removal, we'll provide thorough wound care instructions, including cleaning the area with an antiseptic solution and applying a sterile bandage to aid proper healing. At home, it's essential to avoid picking or scratching at the wound and to prevent Ted from engaging in strenuous activities that could disrupt the healing process. Mihiraa, please keep a close eye on the wound for any signs of infection, such as increased pain, redness, swelling, or discharge, and don't hesitate to seek medical attention if needed. If you have any further questions or concerns, please don't hesitate to reach out.
Your support means a lot to us. Thank you so much for the guidance.
You're welcome, Mihiraa.